Hello and welcome again. This is the second episode of the Balkan Nerd Podcast. I'm your host, Alex Metz. I'm again in Tetovo in the social culture space. And with me today is Ilirid Halili. He's studying medicine here in Tetovo. And my first question would be, how are studies? How are you doing? How's it to be here?
First of all, thank you, Alex. It's a pleasure to be here, and thank you for even considering me. Studies, I guess they're good. They're going pretty good, especially after the pandemic. We're starting to go to the amphitheaters to listen to our professors. We're going physically to our practices because medicine has two parts. It's theory and there's a lot of practice you need to know, and that's really, really good. Overall, I'd say it's good. It's been a little bit tough because our generation was like the first generation to transition from high school to university in a pandemic, and we had to do it all online, and it was super difficult, especially like the practice part. Most of my medical listeners maybe will know that anatomy is a very difficult subject that you cannot just know in theory. You have to go and see some bones, for example. So yeah, it was difficult in the beginning, but I think the transition to going back to the university and listening to our professors like that it's going good, I think.
Yeah, my follow-up question would be how COVID influenced your student life and also student life in general here in Macedonia, in Tetovo, but also when did it come back to more practice parts and more actually on-the-spot studies again?
The when part is very blurry. It's very uncertain because mostly we started going physically again in the beginning of this semester, which was in October. But during the first year, like this is my second year now studying medicine, during my first year we almost didn't go at all. Only in our second semester, and we would do a combination, they called it. A couple of weeks we would listen from the computer, and a week or two we would go physically, and when we would go there we would do our exercises that we had to do physically, like look at human cells with a microscope and stuff like that. So that transition is almost like first year, second year. That period was very difficult for every student, and medical students are not an exception to that. I maybe think it was maybe a little bit harder on us because of the nature of the subjects, that you cannot just study from home. It was quite harder. I transitioned from fourth year of high school, which was great to be in a pandemic, and because you didn't have the end-term exam, so you didn't have to study a lot. And basically, we just got off of school 2 months earlier, and we didn't do anything. But when we went back to university, that was the hardest part, because you actually had to be serious. And there was a lot of problems with online because your concentration went down so quickly. And yeah, it was just a mess. I didn't like my first year of studying at all. I scraped by somehow, but yeah, here I am at second year. I'm actually enjoying it.
Yeah, that's good to hear. Just to add a little bit of contrast on what you just said, I mean, I'm also studying in Germany, and I also started studying before the pandemic really hit, before it even was around. And I mean, I'm studying political science, which is like a social science and a very, very theoretical and word and reading based study. And like, you can't go out and touch politicians. That won't help you in politics, but it will help you in medicine to touch other humans and really interact with the subject on a physical level. So I think for us it was easier to transition to online studies and only online studies because, I mean, of course, the discussions were different, and like a big part of the physical discussion and just talking to other students also outside of class just fell out. But still, I think the contrast to social science and natural science is a really, really big one. Yeah, a follow-up question maybe towards a more broader aspect of the pandemic is how was the pandemic handled here in Tetovo, university-wise, but also in the city, and what changed, and also how far back to normal are you now, and how big is the Omicron scare that's kind of all around Europe right now?
The situation was pretty bad. I in Macedonia and in Tetovo and in the Balkans in general. We had a very bad pandemic and a lot of cases, a lot of deaths. Handling wise, it was okay. Could it have been better? For sure it could have been better. A lot more lives could be saved. A lot more reinforced measures could be put into place to stop people from doing certain stuff, because at least in Tetovo, and we, even when there was a stoppage to go out at night, the policing hours, people would still go out, and it wasn't really reinforced, especially in the outskirts of the city. And not a lot of police patrols were going on and stuff like that. Well, I think mask laws could be reinforced better, because it wasn't good enough. And in that way, it could stop a lot of disease spread. For the lack of a poor medical system and our hospital, the cases in Tetovo would be mostly fatal. There would be a lot of cases that would go cured, but I would chalk that up to the person's immune system, not the help of the medical system or the hospitals here in Tetovo, because they're very poor. There were several incidents that are very inhumane that happened here. I don't know if you heard this, but the oxygen pipe cut in the main hospital building, and that was the pipe that was supplying a lot of these patients with oxygen needed. As we all know that we need oxygenation during Corona, especially in the harder cases. So a lot of, I think, poor management, poor conditions, very spiteful people, very uneducated people. Yeah, I think it definitely could have been handled better. As to what's right now, I think overall the Balkans are stable right now, and Macedonia and Tetovo are stable. There's for sure cases, but I will give you a heads up that I'm really out of the Corona talks right now, because I don't want to surround myself with them. I'm just telling you stuff I've heard about, just word of mouth, stuff like that. But as I hear, there are fewer and fewer cases right now. And as for the Omicron version, I think there have been a few cases in Skopje, but none in Tetovo. And I think people just don't care about it anymore. They just go out and about their life normally. There's not much people wearing masks inside or outside, not taking preventative cares, even in my university where we study now, and previously during Corona, when the few cases where we would go to the university to study for lectures and stuff, everybody would have a mask. Now almost nobody has a mask, because people just, I guess, are tired of it and don't care much what happens. I cannot understand it, because it was a very difficult period. How was the pandemic for you in your studies? How did it affect you?
Yeah, as I already said earlier, in Marburg in political science, the only effect I had was that I didn't physically go to classes anymore, and I just turned on my laptop and joined them online. But I was or am a kind of lucky case for the students, because I especially my parents were still able to support me and everything. But I know a lot of people who were really dependent on these 450 euro jobs in Germany. It's like a special kind of job where they don't have to pay taxes yet, because they don't go over a certain threshold, and it's a very attractive system for students. And a lot of places that offer jobs like this just closed down or cut staff and everything, because restaurants closed for months, bars and stuff closed down, and yeah, for those people it was really, really hard. A lot of people had really, really problems in handling their financial situation. And the German state tried to offer support for students, but already the financial support for businesses was rolled out really, really slow, and the ones for students were rolled out even slower. It's overall was a pretty bad picture. And I think, again, also in Germany, especially for the natural sciences, students who have to go into laboratories or some on-the-spot studies where you actually physically interact with your subject. I think for those people it would have or must have been so much harder than it was for me, because I still can read texts and discuss with other students about the ideas we have. But yeah, there's a big part that just breaks away. Earlier you already mentioned that the healthcare system in Macedonia has problems, and how far did the pandemic deepen these problems, or how many of the problems were already existing before the pandemic, and which ones just came up because of it?
I mean, our medical system is very flawed, I think, and the problems were pre-existing, and not only in Macedonia and Tetovo, but I think we saw gaps in the medical system all around the world. No medical system was equipped enough to deal with a pandemic of this level. Like, none of them. They all had to build hospitals to hospitalize the amount of patients they had. Like, none of them. And Macedonia and Tetovo wasn't an exception. The problems were there, and the pandemic helped to shine light on those problems, and it collapsed. I don't know if that's the correct word, but it definitely put a lot of strain on the medical system, on our doctors, on our nurses, and every medical related industry out there, because not only the hospitals had a problem, but also pharmacies with supplying with drugs, and also medical suppliers for masks, for gloves, for different kind of equipment we needed was also a big problem. And in a lot of cases we needed to stretch our hands out to other countries for help, for masks, for example, because we didn't have enough masks to supply to the population, and also vaccines. And when the time came for Macedonia was one of the countries that got vaccinated a bit late of the curve of most countries in the world. Like, it's like a second-hand country, I guess. But the first-hand countries got vaccinated first, and then basically what was the leftovers of the vaccines that they didn't need anymore, they exported to different countries, and we got help from those countries.
Yeah, about the vaccines, how is the vaccine situation in Macedonia? Like, how do you know how many people are vaccinated, and like how big the group is that doesn't want to get vaccinated? Because like we in Germany have actually quite some problems with those people. It's ridiculous and scary at the same time. It's kind of weird.
Well, I cannot tell you the exact numbers of the people who got vaccinated. I think it's most of the population who got vaccinated, even though they probably didn't want to, and was a lot of vaccine illiteracy in Macedonia and in Tetovo. And from the people, everybody would ask like, what they do, they get you more sick. And just basically by hearing stuff by word of mouth, like somebody's cousin, uncle's aunt said that it causes, I don't know, liver failure or lung failure, and they immediately stopped, were discouraged to take it. But I think most of the people got vaccinated, even though they might not want to, but by the restrictions that if you didn't want to get vaccinated, you cannot go to coffees, was a very big motivator for Balkan people, because you know how we are with our coffees. Yeah, we like to go out a lot, and that basically just hit a chord with most people, and just like, yeah, we're getting this vaccine. But the thing I was very surprised about was how many people were anti-vaxxers in Macedonia. Like, I wouldn't think of this country of having a movement like that, and the protest that I think that shocked me. And I definitely, for the proportion for our population, there was a lot of people who protest the vaccines. Yeah, that definitely surprised me a lot. Also, I think a better job could be done with vaccine literacy. There could have been more information spread out of there, and better evidence shown to people that it is helpful. But I don't know how much people would listen to actual medical institutes as opposed to their next door neighbor about this stuff. Yeah, we do have this culture of trusting unofficial information more than official information, definitely. But can I ask you a question now? How bad was this anti-vaxxer movement in Germany as opposed to here?
To be honest, I don't really know a lot about the anti-vaxxer movement here in Macedonia. And I don't really know a lot about those in Germany, but I've seen a lot of protests and a lot of surprise on the side of the state. A lot of instances where the police reacted in a very passive way, in almost like evasive ways. And a left-wing demonstration of this scale would have been met with so drastically different measures, and these people are just they just take the road in a time where it's actually really dangerous to take the road in larger numbers like these. And the state and the police does nothing in, I'm not sure if it's Sachsen or Thuringia, but there were a lot of protests there, and now the head of the federal government, the local federal government, he suggested that the president of Germany, not the chancellor, not Olaf Scholz, but Steinmeier is his name, that he should come and talk to the people and have a public address to the people on that's I think it's really dangerous how much platform they are getting. And yeah, in Germany we can also see the number spikes, and if you just look at the differences in how unvaccinated case and how a vaccinated case influence the medical system and take up resources, then yeah, that shit is just actually dangerous and killing people. That's all I have to say about it.
You also asked me earlier that I didn't answer of how the vaccination process went in Macedonia. I'm not well informed overall, but I can tell you how it went in our city. I think it was very poorly managed, but I don't think the government or the city has much fault in that. I think the main blame is on the people. People would group up before the vaccination points and would just riot and push each other and get in without order just to take their vaccines, and nobody in those crowds would keep a mask on, which is very ironic. Yeah, I think that there's a lot of blame to be put on the people. I think the government or the city could have done a better job in dispersing the amount of people that collected in one point by creating more vaccination points, because effectively there was only two. There was one in the hospital, and at one time there was one in the school near our university. There was this gym that was facilitated to be a vaccination point, and all the resources would go there. There were too many doctors for that area, I think, too many vaccination points for a lot of unnecessary staffing was given to that place, as opposed to giving more vaccination points to people. Then I think a lot of riots outside of the vaccination points, a lot of problems that arise, a lot of problems that the police had to step in to divide, would have been definitely avoided. And a lot of cases that might have started just by being close to people who are waiting in line there, who you don't know if they're sick or not, but you can catch the virus just by waiting with them, because no one was wearing a mask and everybody was shoulder to shoulder, basically. That's how they could have managed it better in Tetovo, but just making more vaccination points. And at least here, it's not an understaffed city with medical specialists. There's a lot of nurses that are out of jobs. There's a lot of doctors that are out of jobs. There's a lot of students who are willing to help with vaccinations. But I don't think they manage these resources well enough to do that. As I said, also a very big blame is on the citizens, because before you get vaccinated, we would the system would give us times, you need to go at 9:30 to get vaccinated. That's your spot. But when you would go to the vaccination spot, there were 30 people behind you, and you would say, but my thing says it's in 9:30. I have to get in. They would say no, why didn't you come here from 7 in the morning and wait like we did, and you like kind of didn't have what to do, and you had to wait in line with everybody. So yeah, not a lot of people who would respect these schedules, I guess we would say. But also the system wasn't equipped enough to handle this magnitude of people getting sick and cases getting sick, and the people needing vaccinations. The system would crash a lot of times. I know when I went to take my second dose was close to the center, and this was the time that it was working by schedules. People would, for the second dose, people would come by schedule, and they would usually let them in. But from the sheer amount of people applying online, and Macedonia being a poor country and not having strong enough servers, I guess, couldn't handle that size, I guess, and the system crashed. And I had to wait 2 more hours to get in, because the people that were supposed to be going in at 3 didn't go in at 3 because the system crashed earlier, and they had to wait for their system to go back up. So everybody would get pushed back an hour, basically. So yeah, that's how it went in Tetovo mainly.
There also more recently was the story about the mobile hospital in Tetovo. Like maybe like first of all, you can also talk a bit about like what exactly the mobile hospital was supposed to do and how it was functioning. But a couple of weeks ago, it burned down, or big parts of it burned down. And I would ask you if you could just go a bit into details about what happened there, and yeah, basically just what happened and how bad it was.
I mean, it was pretty bad. A lot of human lives got lost that would have been very easily preventable to get lost. But overall, that week, I think, or those period of weeks, were very shitty weeks for me personally, and I think for the country. We were just like coming out of the pandemic, we were getting stabilized. There was a lot of things happening in Tetovo at that time, and then the hospital just suddenly one night gets burned, and it was a shock to every person in Tetovo everywhere. And you can see how much everybody got affected by the amount of people who gave condolences the day after or the few days after, that would make marches through respect of the lives lost there. Supposedly the fire got started by an oxygen tank. Somehow the fire spread. The modular hospital was supposed to be a place that was a bit more high-tech to facilitate the people who were suffering from cases of COVID, I think from more serious cases of COVID. And yeah, it was supposed to be that. But from the beginning, the material that it was built was plastic. In my mind, that's a big red flag from it being very, very flammable. Also, I guess the position of the modular hospital wasn't very adequate for rescuing the people that was burned. And I think a lot of people didn't help that night. I personally saw some videos of the incident. I saw it live while happening online because I was far away. And I saw people just recording. And I could hear people crying and screaming from it. I was just like, terrible. It was hell on earth. People getting burned alive on earth. I think maybe people could have just stepped in and helped anyone they can instead of recording them. But I don't wanna cast any judgment on them because I wasn't that night. I don't know the full scope of the situation that night. I don't know how dangerous it was to go in and help people. But it was a shit show all around. I know there's people that witnessed the incident and cannot sleep at night anymore because of how terrible it was, and they need the help of sedatives to sleep at night. A family member worked there, and she said after that night, after I witnessed that, I couldn't sleep several nights because I would just hear the screams of the victims. It was overall terrible. the situation doesn't have much light to how did exactly started. We know the reports of it starting from an oxygen tank, but at least I'm not informed well that how the spark came about to light all that modular hospital. And a lot of investigations went on. A lot of foreign countries sent a lot of investigators to Tetovo to shed light on the matter, to who's to blame here. But at least I haven't seen much media attention on the reports, and I don't know if they're even a thing now. I don't know if there's reports on what happened, on who's to blame, and even if there is, there's very not at all that I've seen media coverage on what happened. So yeah.
Yeah, I actually think there are no reports so far. Also, just to edit, 14 people lost their life in the fire that night. Is there any infrastructure at the hospital that replaces what the modular hospital was supposed to do, or is that place just lost and not replaced at all?
Very good follow-up question. No, there's not. Like, the whole reason that the modular hospital was built because we didn't have enough housing for the sick, and now that it's just burned, it stays there, and the place that it is a very visible place. You can see it from behind the hospital. Like, it's not at all hidden, and no, it just taped off, and for a long period police would stay there and would stop people from going by there, but now nobody stays there, and people just like go by that place very easily, casually. People just go by and I think probably get into the hospital to see what happened. There's currently no facilities being replaced or being built to replace the modular hospital, maybe because of they see there's no need to do so. But I'm not sure what's happening. The cases that are coming up, they're either, if they're more serious, they're getting sent to Skopje, or if they are kept here, they're kept here, and the departments that were here before that. Like, I guess there's not a lot of COVID cases anymore that need hospitalization. Yeah, and also I think that the modular hospital should be removed. All the ruins, all the burnt stuff should be removed. If they're keeping it for ongoing investigation, the investigation should have been over by now, because it's not a very complicated series of events that happened that the investigators need that time. But I think if a report was to come out, the evidence should have been gathered by now, and everything should have been done. And I think the modular hospital should be removed from public eye view, just to take away from our minds that what happened that night, and not every time you pass by the hospital and you see that you're reminded by it. It's not a good sight for the city. It's not a good sight for the hospital at all.
Yeah, to get the discussion to a more positive note again, I would like to ask you the question, like, I mean, you're studying medicine, so one day you're pretty surely going to be a doctor. And would you prefer to continue working in Macedonia, or would you rather go abroad? And what would be your current thoughts, motivations for both of those? And where do you see yourself in a couple of years, maybe?
Well, my thoughts on that topic are very divided. It depends on the day or the events that transpire in my life that I decide to either go abroad or stay here in Macedonia to work. But I don't know. I'm so divided on this. I used to be sure that I'd stay here, but not anymore. I'm very unsure. So basically my two thoughts on my future are, I either stay here and help my people here and help improve on this medical system, help in any way that I can, help my city, help my people. My long-term dream is to open my own hospital and to help people in that way with providing them with better care that our city hospital is providing them, or our current medical staff our current medical system is providing them. But I hear a lot of stories that doctors get beat up or doctors get accused of things that they are not responsible of in this country, and I hear about how much respect people have, that being not much respect for medical workers who sacrifice a lot of their lives, a lot of their youth to bring you this care, to care about patients, but in the end it's basically amounted to zero. You're like, who are you? Who do you think you are? And you don't know anything. And a lot of time your opinion is superseded by what people read on Facebook or what they heard about from their neighbor, that it's a good cure or not. Yeah, I'm very divided. So the options are like stay here in my country, also with the people I love and my family, but also help my people. But by doing that, I might have a very difficult time, or go abroad, have everything fixed for me, I guess. Like if you go to Germany, you basically apply for a job and they will find you a job instantly, and you have to move like to that city where your job is, and you just have a position and everything. Like you're well respected, you're guarded, your people are like patients are nice to you. But the downside is you're far away from your family. Like you have to live a very cold life, I guess, in these more developed countries. Like people just don't care. You don't have a lot of support in that grounds, as opposed to here, where if something happens, your family is there to step in, and you'd be just on your own there. So those are the options: either leading a more difficult life here, but having that warmth, I guess, or just going to countries like Germany, I guess, you will have a very secure perspective for your future, but you might not you might not feel that warmth in your day-to-day life of your family, or like having any purpose, I guess, because you will have this fixed dynamic life. Yeah, I'm not sure what I will choose. There's a lot of time ahead of me to decide. Till then, I will think about it even more. Yeah.
Yeah, I think there are a lot of things in life where time is the only thing that can tell. Yeah, on this more positive outlook towards the future, I think we can end the episode. And I thank you very much, Ilirid, for being here, for being my guest and coming on the show. And yeah, thanks a lot. Do you have to add something?
I don't think I had to add anything. I just want to thank you again for inviting me, for making me a part of this cool podcast you have going on here. I want to add, as I guess the thing in the end, just I'm by any means not a professional in any standard. I'm just a medical student in training. Everything that was said was what I experienced in my country and what I heard about. So that's what I told you. I just wanted to give you a lighthearted conversation of how I experienced things. Again, thank you very much for inviting me, and I wish you the best.
Thanks a lot. It was a real pleasure. And also thanks everyone out there for listening, and hear you next time.